వెల్కమ్ బ్యాక్ టు వైజాగ్ డోపమైన్స్. ఎర్లీ ఏజ్లో డయాబెటీస్ రావడం, టీనేజర్స్లో షుగర్ లెవెల్స్ పెరగటం అండ్ విమెన్లో పీసీఓసిస్ చాలా కామన్ అయిపోతున్నాయి. సో ఇలాంటి హెల్త్ రిలేటెడ్ టాపిక్స్ గురించి మాట్లాడడానికి మనతో MGM 7 Hills హాస్పిటల్ నుంచి కన్సల్టెంట్ అడల్ట్ అండ్ పీడియాట్రిక్ ఎండోక్రైనాలజిస్ట్ మనతో ఉన్నారు, డాక్టర్ CH Mounika Anitha గారు. వాట్ ఆర్ ద ఫస్ట్ థింగ్ యంగ్ విమెన్ షుడ్ బి డూయింగ్?
In these people especially.
So how alarming is this for the doctors themselves?
Doctors themselves from medical perspective.
Apart from this, what kind of
medications, it depends upon the type of diabetes.
Elanti lifestyle changes suggest chestaru. Correct.
It is better to adopt.
Let's understand the difference between diabetes type 1 and type 2 diabetes.
The carbohydrates within the food, first of all, it gets absorbed into the blood. So after that, the glucose from the blood has to be entered into the cell because we use glucose as an energy source. For this, the glucose to be entered into the cell, we need a hormone which is called insulin.
Okay.
And insulin is the hormone which is produced from the pancreas.
Okay.
The beta cells of the pancreas will produce insulin.
Okay.
So what happens in type 1 diabetes is there is complete absence of insulin. So the glucose levels will get pulled up within the bloodstream.
Okay.
So it results in diabetes. So what happens in type 2 diabetes is there is some amount of insulin secretion, but the body doesn't respond to the effects of insulin. There is resistance at the level of action of the insulin, at the level of muscle tissue, liver, as well as adipose tissues. So in type 2 diabetes, there is insulin resistance as well as related insulin deficiency. Over the years, in type 2 diabetes also, the insulin secretion gets decreased.
Okay. So common ga చూసేది ఏంటి మనం? Type 1, type 2. Okay.
90% of the adults will have type 2.
From what age are we seeing this kind of a problem nowadays?
Now type 2 diabetes is seen from children to adolescent age also, but most common in the age group from 35 years of age. So but nowadays we are seeing in younger generation also.
Yes, even I think 20s lo kuda. Yes. So how alarming is this for the doctors themselves?
Doctors themselves from medical perspective. As we are seeing earlier onset of diabetes now, the management of diabetes is also we have to be more aggressive because in earlier the onset of diabetes, in these people especially, like compared to older adults who are having diabetes, there is rapid decline in the beta cell function. Means the beta cells which are at the time of diagnosis, at least 20% of beta cells are preserved.
Okay.
But the remaining, that 20% is also rapidly declining in younger the onset people with diabetes.
Okay.
So they need insulin earlier. Previously, insulin need is there after about 8 years or 10 years. But these younger onset individuals, they are requiring within 5 years. So one is the disease phenotype is more severe in younger adults, and also in younger adults the adherence to treatment is also is not as good because of their lifestyle habits or because of their social careers and all. The adherence is also, behavioral changes are also very difficult in adult patients.
So ఇలా వచ్చినప్పుడు యంగ్స్టర్స్ లో మనం ఎలాంటి చేంజెస్ చూస్తాం?
ఈ హై షుగర్స్ వల్ల there is damage to nerves, kidneys and eyes. These are so affecting these three organs that nerves are damaged. The patient may get peripheral neuropathy.
Okay.
So initially they present with paresthesia, తిమ్మిళ్ళు రావడము, కాళ్ళు మంటలు రావడం, అగ్గి మీద నడుస్తున్నట్టు ఉండడం, ఇవి కంప్లైంట్స్ వస్తాయి. సో later on అది సివియర్ అయ్యేసరికి they lose complete sensation, so they don't feel the pain. What happens if they had some injury?
Okay.
They may not feel the pain. Slowly ulcer will get developed. It might lead to amputations if vascular supply is also diminished.
Okay.
So this is one: neuropathy, foot ulcers and amputations.
Okay.
And when kidneys are affected, patient will lose albumin in the urine as well as creatinine levels will raise.
Okay.
Because of this diabetic kidney disease. Slowly there will be progression of diabetic kidney disease resulting in end-stage renal disease and dialysis.
Okay.
And when eyes are affected, the retina of the eye, inner nerve of the eye will get damaged. Initially there won't be any symptoms. Symptoms are not seen. Only in the later stages only we find blurring of vision. Like complete picture is not seen. They will see some dark spots while they see any vision.
Okay.
So that much blurring will be seen. So in advanced stages, there is complete loss of vision.
Vision also.
So these are only screened earlier. Only we can find these complications early.
Okay.
And coming to the macrovascular, large vessels are affected. Heart, stroke, because of the blockage in these major vessels because of atherosclerosis and all. So their diabetes people are more prone to develop heart attack and stroke compared to those who are not having
డయాబెటీస్. ఓకే. సో మీరు ఎలాంటి మెడికేషన్ ఇస్తారు అండ్ ఎలాంటి లైఫ్ స్టైల్ చేంజెస్ సజెస్ట్ చేస్తారు?
So lifestyle changes are the most important treatment part.
Okay.
So we have to choose healthy eating habits. At least follow a Mediterranean diet. So like that, we should eat more of vegetables, green leafy vegetables. We should cut down red meat. Eat more of lean meat. So I will just suggest to avoid mutton, shrimps and all. So eat at least 2 portions of fish weekly, twice a day.
Okay.
Chicken 100 grams, skinless, once a week. That can be used.
Okay.
And most of the sources should be from the vegetable sources, plant-based diets. And we should reduce the carbohydrate intake. So limit white rice. It is better to adopt brown rice, to eat brown rice. So పొట్టుతో ఉన్నవి ఏదైనా తీసుకోవచ్చు. So we can shift to millets, anything.
Okay.
So carbohydrate, right, maida should be avoided. The use of oil also should be reduced.
Okay.
Right. And do a regular physical activity at least 30 minutes per day. If daily is also not possible, at least 150 minutes per week. Alternate days also can be done.
Can be done.
So regular simple brisk walking, fast గా నడిచిన ఒకటే చాలు. No need of going to
So
gym.
apart from this, what kind of medication?
Medications, it depends upon the type of diabetes. For example, type 1 diabetes, we should use insulin only. But type 2 diabetes, if there is initial levels of good insulin secretion, so we use, as there is insulin resistance, so we use drugs which will decrease insulin resistance.
Okay.
So we have many drugs like metformin, pioglitazone, which decrease insulin resistance. Nowadays we have newer drugs which are used for the last 10 years.
Okay.
Like SGLT2 inhibitors, GLP-1 receptor agonists. They not only decrease blood glucose levels, but they're also beneficial for preventing the development of diabetic kidney disease as well as heart diseases.
Okay.
These medications, they also result in weight loss.
Okay.
So eventually in type 2 diabetes patients also, they require insulin. So even when they have reached maximum doses of these oral drugs and still the glucose levels are not under control, then they have to take insulin.
మనకి డయాబెటీస్ ఉందా లేదా అని చెక్ చేయడానికి హౌ ఆఫెన్ మనం మెడికల్ చెకప్స్ చేసుకోవాలి?
Screening annually, every year.
క్యాన్ స్ట్రెస్ ఆల్సో బీ అ కాజ్ ఫర్ ట్రిగరింగ్ డయాబెటీస్?
Yes. Stress also results in triggering diabetes. So in the background of insulin resistance and genetic factors, family history and all, this stress also leads to increase in the development of, contribute to the development of diabetes. So stress levels when are there high, we also have excessive stress related hormones. For example, cortisol, which is a stress hormone.
Correct.
Cortisol increases glucose production.
ఓకే.
Also increases insulin resistance.
సో డయాబెటీస్ని మనం మానిటర్ చేయడానికి ఐ థింక్ నౌ డేస్ వీ హ్యావ్ దీస్ కంటిన్యూస్ మానిటర్ systems, right? So how far are they ethical and how far can we trust on these devices?
When we are using CGMS, we should use FDA approved CGMS, not over the counter ones.
Okay.
There are some certain standards which only some companies are providing now. We normally use Freestyle Libre Pro.
Okay.
So these especially they are useful in type 1 diabetes patients.
Okay.
And type 2 diabetes patients who are receiving multiple daily insulin. Insulin మీద especially insulin, multiple doses of insulin తీసుకునే వాళ్ళకి they are most beneficial. They are shown to reduce HbA1c reduction because proper monitoring, whenever the sugar levels are rising up, we will get a notification. Whenever there is down also, we will get.
Right.
So the management has become very easier in type 1 diabetes patients and type 2 who are on insulin.
Correct.
As far as those who are not on insulin, even they have used, there are certainly, the patient can notice what type of food he's giving a glucose spike to him. So there will certainly behavioral changes will be there.
Monitored.
He will definitely reduce the type of amount of food, even though despite we counsel regularly, once patient experiences on his or her own only.
So you say CGMS are good option.
For type 1, they should use continuous adherence to the CGMS. It should be there because it should be changed every 14 days.
Okay, 14
Cost is also little bit higher. It will be
Okay.
around 5,000 for 14 days.
So you need to change that instrument.
Only for 14 days it will be working. It will be used.
Oh, okay. So అది మరి లైఫ్ లాంగ్
Type
వాడుతుంటారా?
1 lifelong it is better, but cost issues are there as of now.
Avunu,
For type 2 diabetes, if there are the patient suppose is experiencing recurrent hypoglycemia and patient is getting hyperglycemia also.
Okay.
So in those cases, just to monitor what is happening to the patient, we advise for 14 days. So we will see the glucose patterns,
Okay.
and then we will change the course of the treatment.
ఓకే.
At least for type 2 diabetes, short term use we are advising.
టీనేజర్స్లో షుగర్ లెవెల్స్ పెరిగిపోతున్నాయి ఈ మధ్యన. జస్ట్ ఎక్స్ప్లెయిన్ us why are we seeing these kind of changes
Now,
in children?
obesity is a major, it's already endemic now. So,
Okay.
obesity has been observed from childhood itself.
ఓకే.
So, when there is family history of diabetes, there eventually the child is also more prone, 90% prone to get diabetes.
Diabetes,
Type.
okay.
And nowadays, during pregnancy also, there are rising cases of GDS and all that.
Yes.
So the fetus who are exposed to hyperglycemia, high glycemic levels during pregnancy is also at risk of getting diabetes.
Diabetes,
So all those
okay.
are having diabetes in the early
ages, all
So
these
increasing
reasons.
the risk of obesity, increase in insulin resistance, and this genetic risk factors, as well as increase in the GDM and all.
Okay.
And from childhood only, we are itself, even parents, we take our child at least weekly once or monthly once
yes,
to this
yes.
KFC, and
Correct,
we are
correct.
also pushing junk
Yeah,
food to
somewhere-
them. And everyone in the schools from morning 8 to evening 7 p.m. the majority of them in the schools without
Yes.
any physical activity.
Correct.
So all these are giving rise to increased level of diabetes in children
చిల్డ్రన్
and
ఆల్సో.
adults.
PCOS. ఎస్, ఇది మనం యంగ్ విమెన్లో చాలా కామన్గా చూస్తున్నాం ఈ మధ్యలో. వాట్ కుడ్ బి ద రీజన్స్ ఫర్ దిస్ ఇంక్రీజింగ్ ప్రాబ్లమ్ ఆఫ్ PCOS?
PCOS also, the risk factors are same genetic risk factors
Okay.
are there. In the background of that, these lifestyle disorders, it's also a lifestyle disorder. So lack of physical activity, excessive intake of this canned food, carbohydrate food leading to obesity, insulin resistance.
Okay.
Because of this, the incidence of PCOS has been increased. And not only that, environmental toxins also, nowadays they are increasing the incidence of diabetes.
Okay.
There are certain endocrine disrupting chemicals which will mimic the effects of these hormones and their effects. So they are affecting the ovarian function. So they are also leading to increased risk of PCOS.
సో PCOS వచ్చిందంటే బాడీలో ఎలాంటి చేంజెస్ ఉంటాయి, అండ్ వాట్ ఆర్ ద సిమ్టమ్స్ దట్ వన్ కెన్ ఐడెంటిఫై?
So the PCOS diagnosis is mainly based upon 3 criteria.
ఓకే.
One, the patient should have irregular cycles.
ఓ,
Oligoanovulation. The ovulation, every month there should be ovulation for the woman. Here in PCOS, there will be whether the ovulation occurs more than 35 days, means periods delayed ovulation,
delayed, okay.
or delayed cycles, or complete absence of ovulation.
Okay.
So there is no period amenorrhea like this. So irregular periods should be there. And the other thing is either they should have a clinical or biochemical hyperandrogenism. So what happens clinically? Excessive facial hair, a thinning of the scalp hair,
Okay.
and increase in the acne, they will be there. Not only facial hair, excessive androgen terminal type of black hair will be seen over face, chin or upper lips, or on the chest or abdomen will be seen, on the legs also. So this is clinical. Biochemically, we also test for hormones. What about androgen hormones, male hormones inside the body? So normally there is certain limit for a female to the minimal, the level should be low. If the levels are higher than the upper limit of normal, like for example, based upon the test we use, we
Okay.
can consider more than 60 is abnormal.
ఓకే.
So male hormones are in excess in our body, androgen hormones.
ఓకే.
Okay, and another thing is PCO morphology and the ultrasound pelvis. So ovary size will be increased because there are number of peripherally arranged cysts. Like they are not really cysts. That the follicles have been grouped here in the ovaries.
Okay,
So
okay.
overall the ovary size is increased, which is producing more of these hormones.
సో ఇప్పుడు PCOS ని మెడికల్గా టెస్ట్ చేయాలంటే వాట్ ఈస్ ద టెస్ట్ దట్?
Yeah, we do early morning fasting sample. We do for testosterone levels.
Okay.
Serum testosterone, androgen we can do. If the levels are high, what causes these high levels? Either only simple PCOS or there are other adrenal disorders also.
ఓకే. వెయిట్ గెయిన్ అండ్ PCOS గో హ్యాండ్ ఇన్ హ్యాండ్ అంటారు.
Yeah.
సో ఇది నోటీస్ చేయగానే వాట్ ఆర్ ద ఫస్ట్ థింగ్ young women should be doing?
As I said, once we are doubting whether it is PCOS or not, first consult a doctor, and then for proper diagnosis, we should do all the required tests.
Okay.
So weight gain itself, because of increase in the insulin resistance, their PCOS can develop. Weight gain also happen in hypothyroidism. And that also leads to PCO morphology change in irregular cycles.
Okay.
So we should rule out thyroid disorder and other disorders and all. If the patient also have insulin resistance, there may be pre-diabetes also.
Okay.
So we need to test for metabolic syndrome test, like simple fasting plasma glucose or santiagram
Okay.
OGTT is done. Thyroid profile is done. The patient is having clinical hyperandrogenism or patient is having irregular menstrual cycles, and we also go for ultrasound pelvis and all.
So thank you, doctor. Thank you for coming over to our show and giving us such useful insights about these diseases. So చూసారుగా వ్యూవర్స్, మౌనిక గారు ఎంతో చక్కగా మనకి డయాబెటీస్, హై షుగర్ లెవెల్స్ అండ్ పీసీఓస్ గురించి ఈ డిజీజ్తో రిలేటెడ్ సిమ్టమ్స్, హెల్త్ రిస్క్ అండ్ మెడికల్ టెస్ట్ అండ్ ప్రికాషన్స్ ఎలా తీసుకోవాలో ఎంతో చక్కగా మనకి చెప్పారు. సో ఇలాంటి ఎన్నో మంచి హెల్త్ టిప్స్ గురించి కీప్ ఫాలోయింగ్ వైజాగ్ డోపమైన్స్.